Hey everybody, Dr. Sandra here. Wanted to talk to you today about epidemiology. Big topic that we're going to try and tackle pretty much in about 45 minutes just to get an idea, an introduction to what it is and why it's so important for a community health nurse, public health nurse to understand the concepts of behind epidemiology and behind understanding, using the data to unravel the mysteries of what's going on with health and disease among communities. So we're going to go ahead and talk about that. Before we pursue that, I want to actually show a nice little video. It's about 5 minutes long that starts to give an introduction, and then we'll go ahead and hit into the slides with that. So I'm going to go ahead and play that, and then we'll join you back in about 5.
Epidemiology, the backbone of public health, not to be confused with the actual backbone, which is often done by dodgy chiropractors. So if you are studying epidemiology, maybe as part of an MPH program, and you're finding it more confusing than the latest season of Game of Thrones, I don't blame you. When I first started studying epidemiology, I actually thought that I'd walked into a foreign language class. In fact, if you're not a little confused, then you're probably not paying attention. Epidemiology often seems like a complex conglomerate of seemingly unconnected ideas. Again, very similar to the latest season of Game of Thrones. Things like study design, confounding, risk, standardization, life expectancy, attack rates, latency period, telepathy. Okay, not telepathy, I was just trying to make sure that you're paying attention. What I'm going to do is I'm going to try and simplify epidemiology, boil it down to a one-sentence definition that's going to give you some context. It'll be like a canvas onto which you can hang these various ideas so that when you take a step back and look at the big picture, you know exactly how these things fit together. Welcome back to this Global Health YouTube channel. My name is Greg Martin. If this is your first time here, please consider subscribing. I'd love to have you as part of this community of like-minded people who want to make the world a better, safer, healthier place. Now let me start by saying this. If you're working or you want to work in public health, then you absolutely have to have at least a basic understanding of epidemiology. So epidemiology really revolves around trying to measure two things: distribution and causation, and we're going to take a closer look at each of these in just a moment. But first, a big thank you to the University of Maryland Graduate School for their support. The University of Maryland Graduate School offer a fantastic online global health certificate, which if you want to study further can be applied to an online master's degree in health sciences. So if you're wanting to study global health, but you can't take the time off work to attend a full-time course, then this is a really good option for you. Click on the link in the description below to find out more. Now, let's talk about epidemiology. We're going to start off by talking about this idea of distribution. We're interested in how various diseases or other states of health, we could be looking at a health improvement, for example, how these things are distributed in society. So if, for example, we're interested in the distribution of HIV, let's take a look at what that means. Well, we're interested in who has HIV, where physically they are, and how that might be changing over time. In other words, we're interested in the demographic, the geographic, and the temporal distribution of HIV in society. Demographic, so are these people old people, young people, rich people, poor people, males, females, people who do and people who do not understand all the references I'm making to Game of Thrones. So we're really interested in this broader definition of social demography, any parameter that will help us understand the different sections of society. Geographic, well, that's pretty self-explanatory. It's where physically these diseases or various states of health might be. And temporal, and here we're interested in how the incidence and prevalence of a disease is changing over time. So firstly, we're interested in the distribution of diseases and other states of health, and we call these outcomes. But we're also interested in the distribution of exposures. And these are anything that may cause or prevent disease in the community. Now, exposures could be environmental hazards, things like severe weather events, meteorological events like an earthquake, or water and air pollution, or exposure to chemical, radiological, or infectious disease agents, or exposure to social determinants of health, things like conflict, gender inequity, and poverty. And exposures can be things like public health interventions like tobacco taxation, or the provision of medicines or vaccines to treat or prevent diseases. And of course, these kinds of exposures improve health. And again, in this group, we've got the social determinants of health, things like education, employment, the protection of human rights. All of these things translate into an improvement of health at an individual and population level. And this brings us very neatly to the second issue that occupies the minds of epidemiologists, and that is the issue of causation. And here we're thinking about the extent to which these exposures really do or do not genuinely translate into changes in outcomes or the health status of people and populations. So let's talk about causation for just a minute because it's really important. When we see a correlation between two things, as one thing goes up, another thing goes up as well, we often incorrectly make the assumption that there's a causative relationship between these two variables. Now that's really bad science, and believe me, this happens a lot. So, for example, does eating ice cream increase your chances of being attacked by a shark? Of course, there's a strong correlation between ice cream eating and shark attacks because, of course, both of these things happen to happen on hot days in summer. But eating ice cream, of course, doesn't cause shark attacks. There's a confounding variable, which is an alternative explanation associated with both the exposure and the outcome, and in this case, it's hot weather. Now, don't ask me about people who swim in the sea and eat ice cream at the same time. That's just showing off, and you're offering the shark both a meal and dessert at the same time. You're asking for trouble. And there's quite a few other things that you need to think about when you see a correlation between two variables before you make the assumption that there's a causative relationship. And these include things like confounding that we've just talked about, but also bias, error, chance, reverse causation, p-hacking, and fraud, amongst others. And you can take a look at the Bradford-Hill criteria, which incidentally, even according to Hill, should not be used as a checklist. But I'm not going to get into that in this video. I'm going to create other videos, and I have in fact created other videos that look at many of these things. Take a look at them if you're interested. But for now, what I want you to take away is a nice, neat definition of epidemiology. So epidemiology is the science that considers the demographic, the geographic, and the temporal distribution of exposures and outcomes and the causative relationship between them. My channel has got a playlist that deals just with epidemiology if you're interested, so check that out if you want to watch more. Thanks so much to all of those that support this channel at patreon.com. I really appreciate it. Couldn't do it without you. And of course, a big thank you to the University of Maryland for their support.
All right, sorry about that little pause in there. Hopefully that kind of gave you a nice little introduction to epidemiology. Want to help you understand that, yes, it is a large topic, but enough of an idea for us to break it down and be able to utilize some of that information for our roles as community health nurses, public health nurses, so that we know where to distribute the healthcare services that we need in an effective manner, in an appropriate manner, based on what we have learned within those communities, and also based on the evidence that's presented for us. So I'm going to go ahead and put this back up, and let's start talking about this a little bit. So talking about epidemiology, and we've got that introduction. And again, just to kind of remind you, epi is a discipline that describes the structure for systematically, and that's kind of the key word, systematically studying the distribution and determinants of health, disease, and conditions related to health status. So think about linking this back to Healthy People 2020. One of the things that you folks are looking at is the social determinants of health as one component of things that are being influencing community and individuals' health. So think about that as you look at that epidemiology definition and see determinants of health incorporated within that definition. So we want to see where the disease processes, the illnesses are occurring. We want to see when they are occurring, and we want to see how often they are occurring and resolving. Okay, so those are kind of the things that we're paying attention to. In epidemiology, the concepts are used to understand and explain how and why health and illness occur in human populations. So again, we're looking at the where, the when, the how, the why, and that helps the epidemiology, the numbers help give us a story behind what's going on. So we want to take those numbers and help apply it to our whole assessment scheme when we're developing community health programs, when we talked about screenings and referrals. That process we want to look at what the numbers are showing us so that we can effectively hit those audiences. One of the things that you're looking at with epidemiology is using population-based data. And when you're using that, the one thing from our standpoint we need to, again, recognize is that the nursing process is going to be very integral into managing what's going on and applying it to the respective communities. So there's a couple of terms that you need to be familiar with. So when you go through your chapter, you will also see that there are tables, there are graphs that speak to examples of some of these terminologies, and more, I won't say importantly, but additionally, there are going to be equations, basic equations associated with it. So you want to become familiar with those equations and get a basic idea with that, okay? So the first definition you see on here is rate, and it's basically making comparisons between groups. So if I wanted to see the rate of an event that's happening, so for instance, I believe the book talks about teen pregnancy. So the incident of teen pregnancy and this zip code versus this zip code, okay, we can get an idea based on rate. And that's a way to help us determine, once you standardize the equation by multiplying it by 1,000, that's what you'll typically see, it allows us to make a numerical comparison to how often that is occurring, okay? Ratio is another terminology, and you'll see on the screen for you, it's comparing one number with another. And that's kind of the bottom line in what you're looking at with that. So when you're looking at ratios, it's often used to compare one at-risk population with another. That's just kind of the basic idea with it. Now, two key terms that you want to pay attention to are the terms of incidence and the term of prevalence. Okay, incidence and prevalence. So for those of you who happen to be involved in the course, you will see that I've uploaded a video, a short, brief video that further explains the difference between incident and prevalence, but I'm going to give you a brief explanation of it now. So when you're thinking about incidence versus prevalence, incidence is just that. It is what cases have occurred during this specific time frame. So how many cases of sleep-deprived people did we have between for the next 24-hour period after Game of Thrones finale came through? Okay, I want to know within a designated time frame of those individuals based on those criteria. Okay, then prevalence will look at not only the incidents, which are just those new cases that occurred, but all the other existing cases. So if I'm taking my example of the sleep-deprived folks, it's not just the sleep-deprived folks who watch Games of Thrones, GOT, just in that last episode, but maybe it's the group of folks over the time, all the existing cases of sleep-deprived folks, and we'll use, just for the sake of using the example, the GOT over the whole season, okay? So that's going to be a bigger number typically than incidence. Okay, so that's where you get the idea between incidence and prevalence. And again, for those of you who happen to be in the course, you can look at another quick video. I think it's about 5 minutes long that kind of helps summarize that a little bit too, and put some numbers related to it for your example. Okay, so rate, ratio, incidence, and prevalence are all key terms that you're going to numerically calculate to give us an idea of comparing. All right. Rate and ratio helps us do a lot of comparisons, and then incidence and prevalence helps us identify what cases are there and whether they are just new cases or all existing cases. So rates basically, again, and it kind of breaks it down here, are comparison between groups. So we could have a crude or adjusted rate. You'll hear that terminology often when we're looking at a total population. So if we're looking at the population of the United States, they're going to have basically some type of crude or adjusted rate. You'll hear that terminology based on whatever disease process we're looking at. So heart disease, for instance. Then we could look at subgroups as well. Okay. So maybe out of the US, we may be looking at African-American gentlemen over the age of 55. Now we've kind of narrowed down that population to a subgroup of that population. So instead of the term crude rate that we have for the general population at large, okay, now we're looking at specific rates. Okay, so we can use and stratify our rates, our specific rates by age or gender or ethnicity. There's a number of ways you could subdivide your population, but understand that that's the key point, is how you subdivide. If you're subdividing your population and getting a rate from that smaller population out of a larger one, it's specific rates. If it's a larger one, it's adjusted or crude rates. So there are types of studies, and this is where it goes beyond just understanding the basic concept, but you could study this. There are folks who get PhDs in epidemiology. It's very intensive discipline that you could get involved in. But one of the key things that you want to get out of this presentation today is that we're not only just looking at the rates, but we can then incorporate that into different types of research studies that will help us further explore what is going on with our community, what's going on with our population as it relates to a certain disease process, for instance. Okay, so you'll see a few of them listed here on the slide for us right now. So let's talk. Descriptives is one type of study that is commonly used, and it basically helps us identify not only just the kind of the rate that we saw on the previous screen, but how everything, that disease is distributed. So, and we can determine the distribution of that disease by a number of those subcategories that I spoke to earlier. We can look at age, we can look at gender, we can look at ethnicity, all those things. We can look at other things that are listed on the slide for you, include time and things that can affect. So all those things can have a play on it. So we want to see the impact of a person who has a disease and they are located in the southwestern region of the US versus the northeastern region of the US. And we can kind of see what's going on in terms of the distribution of heart disease in the southeastern part versus the northeastern part, okay, and get that idea, okay? Notice that the term prevalence is incorporated in there. So remember, prevalence is incidence plus all the cases that are available for that population, okay? Analytic studies is where you are testing hypotheses, okay? That's the big thing that you're wanting to do. So just to kind of remind you, hypotheses are basically your inference to saying that there is going to be some type of change that occurs as a result of putting certain conditions into place. So for instance, I could have a hypothesis outside of like this course. Let's say, for instance, I have a hypothesis that if I teach my online nurse educators about different educational technology tools, 2 or 3 of them, they will more likely use them and feel more comfortable with them, okay? So I'm expecting some type of change. That's the alternate hypothesis. The null hypothesis, just to remind you, is that you are not expecting that change to occur even with that new condition being put into place, okay? So with analytics studies, one of the couple of types that are listed here are cohort and case control. Cohort is basically just that. So for instance, I could look at you guys, the class, okay, as one cohort, and I could compare and say, I could have look at if I have you do some type of exercise program while we have our time together during this course, that will help ease your stress, okay? And then what I could do, along with measuring the incidences related to the rates of stress, which you could kind of biologically use biometrics with it, you could also use some other scales to see, is the stress before versus the stress after, did it decrease? Did it really significantly change for us? And we use statistics to help us determine that, okay? But we can use the cohort to kind of determine that. That cohort I use as an example for you, you guys, you can determine your cohort. But the thing about a cohort is that a lot of the conditions have to be into place for all of the people within that cohort, okay? Case control is another type of analytic study. Again, the hypotheses are being tested with it, but where case control is different from what we're talking about with the cohort, is that case control are retrospective in nature. Okay, so that's kind of the big thing. So I'm not going to, as the experimenter, try to put anything on and change a condition. Something happened in the past where a condition changed, and I am actually going back, grabbing the data to look at what's going on. Okay. So the health outcomes already occurred. So we could use, for example, the measles outbreak. Now that it seems to be calming down, we could gather information retrospectively to explore what was going on with that situation and seeing what things might contribute to that situation occurring. Okay. The advantage of case control is that you may have situations just like this measles outbreak that may not happen that often. So when it does occur, it gives you that opportunity to explore it more. Okay. Then we go to the next level. So as we are going down this list, the farther down this list we go, the more rigid the type of study you're conducting. Okay, so descriptive study has some conditions associated with it, but it will give you a little bit of information, and it gives you good information. Don't get me wrong when I say that. But when you get down to experimental trials, there is a very rigid method in terms of how you are conducting your study. You are making sure that there's a number of set conditions put into place, and you are very clear in how you're putting those conditions into place. You are testing hypotheses similar to what we talked about with the case control and the cohort studies. But the biggest difference between those other analytic studies and the experimental studies is how you randomly assign people within groups. Okay, so I won't know as a individual. I may arbitrarily use I might use a program that arbitrarily picks individuals, the data for individuals to go into the experimental group or the control group, for instance, okay, to give me an idea. So I'm not picking, I don't get to necessarily see what's going on, but it's randomly assigned in some way. And you need to be transparent in how you are doing that random assignment, okay? Again, Healthy People 2020. When we're looking at Healthy People 2020, we talk about this pretty much with every lecture, community health. You need to focus on those four main overarching goals, but they're national health objectives that we see each decade. We're getting ready to ramp up for the next decades, 2030s. We're identifying goals and priorities to improve the health of the U.S. population. So remember, there's 42 objectives that we're looking at. We have 4 overall goals, we have 42 objectives, and then we have a number of specific objectives underneath those general 42 categories, and ways that we can improve health based on different topics such as HIV, such as cardiac health, such as mental health. So those are the things that we're looking at. But what I want to point out with this is, as it relates to epidemiology, when you're looking at Healthy People 2020, one of the lenses that you can use is from an epi lens, and you're going to have emphasis that is going to be given to specific cohorts. So for instance, you see listed on here, I simply put anybody who is considered a vulnerable population tends to qualify as a special cohort. You could think of other examples. They have babies, kids, they have the elderly, we have women. You can think of, for instance, prisoners. We can think of folks who are in vulnerable situations, folks who are sexually trafficked, for instance. So there's a number of categories of special cohorts you could give emphasis to. So you want to pay attention to that and making sure that it's a balance between understanding their world, but not necessarily totally generalizing to it as well. Okay, we have to do that in community health some to help us have avenues to go in, but from a nursing standpoint too, you need to recognize that there's still individual differences, even though we are aggregating that data. So other concepts related to prevention, health promotion, and disease. So we're going to talk about some of these concepts, the natural history of disease. We've been very familiar with the levels of prevention. We're going to talk about the epidemiological triangle. I'm going to show you a short video related to that. And then we're going to talk about multiple causation of disease, which I think a number of us are familiar with. So when you look at this busy slide on the natural history of disease, you see a lot of things going on up in here right now. So when we're looking over the course of the history of human disease, one of the things you'll see towards the your upper left corner, underneath that first line, is some of the interrelations of the agent, the host, and environmental factors. These conditions put into place will contribute to what is causing the stimulus to occur, okay? And then we have the reaction of the host to that stimulus, those three components that we just spoke of. So it shows you how it takes the person, the host, through the different stages of the process once they are receive that stimulus, okay? One of the things that you want to pay attention to is I'm going to skip down to the bottom of the slide or towards the bottom of the slide, and then we'll come back up and talk about each of those subcategories, okay? What this slide shows you is that one of the things we're trying to pay attention to, along with the natural course of a disease, the natural history of disease, is the level of preventive measures that can be used that correspond to the process of disease, okay? So that's what this is kind of showing. So you will see that towards the bottom, you have the levels of application of preventive measures, and then you have the different levels of prevention that we have spoken about before: primary prevention, secondary prevention, and tertiary prevention. Remember, primary is before disease comes. Secondary is screening because they are potentially at risk for disease, and then potential referrals. Tertiary is we have the disease, we're trying to combat further problems with the disease, going through rehab, things like that, okay? So you will see from a community health nursing standpoint, there's a few things you want to pay attention to. You'll see in the middle of your slide there, you're going to see 5 columns. You see health promotion is where the pre-pathogenesis period is. That's the period where all the agent, host, and environmental factors all start to kick in together. Remember that, that's before it's introduced to the host. The reaction of the host is having an issue right now. So before we get through that, you want to, from a community health nurse standpoint, what things can we do to counteract that, so we don't have a person who's necessarily going through the pre-patho period, okay? So things like health education we're looking at, okay? Genetics is an increasing example of things that we're looking at to help prevent ahead of time so that the disease does not really occur. Personality development. And you wouldn't necessarily think personality development at first thought, but when you're thinking about holistic health and you're looking at it from mental health aspects, you're looking at it from societal aspects, the personality development is going to be a component that you want to pay attention to. Other things such as marriage counseling and sex education are things that you want to pay attention to, because disease processes occur in different environments as well. So you want to pay attention to those areas just as much as from an individual standpoint. Good standard of nutrition is listed here. Developmental phases of life. So how do we adjust our nutrition as we grow, okay, get older? So that's some of the things that you can do as a community health nurse to help prevent in that pre-pathogenesis period, okay? You also have protective measures that you can help employ. So things such as specific immunizations is going to be a big area right there. Just attention to hygiene, specific nutrients that you're going to incorporate, protection from carcinogens. You see, those are things that we know that are contributing to disease, and we're trying to, from our standpoint as community health nurses, teach our community about, so that they are limiting the exposure to those things that are bad and contribute to further damage, and then those things that are potentially good and help our protective mechanisms. So some of the foods we eat are considered protective mechanisms against certain disease processes. So that's examples of that. And you'll see that also comes under the pre-pathogenesis phase. Then we get to the period of pathogenesis, and then we have those three components that fall under there. Two of these columns fall under the secondary prevention, and the one follows under the tertiary. So early diagnosis and treatment is going to fall under the secondary prevention. So your screenings are going to come into that period. So this is when, remember up above at the top, when we're really, now the host is introduced to the disease. So it's starting to go through that process. So how do we either kick that issue out and stop it as best as we can? That's where we're at right now. Okay. Or if it's in there and it's kind of, worked some of its quote unquote magic, how do we help lessen the disease process, the progress, and the prevent further damage to your body, further disabilities, for instance. Okay. So we can look at some of the data. So epidemiology, one of the first things they list up here is case finding measures, individual and mass. So what type of fact finding, what kind of data measures can we look at from an individual and a mass population basis so that we can help identify what's going on and help lessen that impact. We can look at the objectives of curing and preventing disease processes, shortening the period of the disability if there's a disability that comes into play. Any complications, sequelae, we want to look at that, and decreasing and preventing the spread of communicable disease. Those are things that we want to pay attention to, as well as disability limitation. So facilities to limit disability and to prevent death, we could look at from a community health aspect, how we have those available to clients within that particular community. So your patient had a TIA, they actually went into a mild stroke. Do they need to go into rehab after? What are some of the rehab facilities to limit some of that disability, okay, and help to prevent your patient from further episodes. Finally, we get to that tertiary prevention where it's really truly rehab. You're gone through pretty much the whole disease process. Note at that stage, okay? With the pathogenesis, you pretty much have gone through it. Now you're in kind of recovery mode. It may be a new normal that may be very realistic for the clients who are experiencing that particular disease process. So now what do we do from a community health standpoint? We're educating the public and industry so that we can utilize those who are rehabilitated, okay? We can look at things such as how do we reintroduce those individuals back into society based on their new normal. That's kind of a big thing that's going to go on with that, okay? And you can look at some of the other points associated with it as well. So we've talked about levels of prevention, Lavelle and Clark back in 65. So we've mentioned that in a number of categories, and I just mentioned it on the previous slide as well. So the other thing that I wanted to let you speak about was the epidemiological triangle. And I wanted to make sure that you had an idea of what was going on with that. So in order for that to happen, I want to pop up this video for you. So give me just a second here, and we're going to broadcast this video. Let's get that magic to occur here. And let's get it started for you. So we're going to talk about the epidemiological triangle, and we're looking at the three components of that triangle that's really vital in epidemiology. So the host, the agent, and the environment. Host, agent, environment. Okay, I'm going to have a quick explanation. It's about 3.5 minutes long, and then I'll be back. Maybe I won't. And let's go, give me a second here. Sorry, it doesn't let me skip. All right, oops, oh, went too far. All right, so we've talked about that a little bit. We'll get that video to you. But the three components that you'll see here is the agent. So what's causing the disease process to occur? Okay, that's one of the things what are the contributing factors to it? So is it biological in nature? Is it chemical? Is it physical in nature? What are the contributing factors that are contributing, causing this particular condition to occur? Host is your susceptible person, okay, or your host. So it's the living species. It's the one who's receiving what's going on. It's got that agent introduced into them. And for some reason, a lot of the times our defenses, our body defenses will take care of a lot of it. But there's times where our defenses are down or it's worked its way around that the agent is introduced into that host. And then you have the environment. So anything that's external to the agent and or the person. So other contributing factors outside of that. Okay, so you want to pay attention to those three components. And when we're talking, you saw that the environmental factor on the previous slide, there could be a lot of conditions that are contributing to, if you think environment outside of the disease and the person the host who's, susceptible to that disease, there are a lot of contributing factors that can cause that to occur. So the web of causation is another terminology that you want to be comfortable with, okay? And it's looking at a multifactorial causes of those diseases, okay? And it's not just looking at how the disease is initially caused, but then what impact that disease has, okay? And how that disease can have an impact on a person who may not have any other conditions, or a person who might have other, and increasingly see this, chronic illnesses that this other new disease is competing with, okay, and contributing to. So the web of causation is basically strongly implying that there's multiple causes and there's multiple effects, okay, based on the conditions that are put into place. So one of the things you as a CHN need to do is identify what type of conditions are put into place for these individuals that is contributing to this disease process, hurting them or contributing to further disability or things like that. So that's what you want to start paying attention to. So we've talked about, early on, we talked about the different terminology for epidemiology. So we talked about rates and ratios. We talked about incidence and prevalence. We've talked about what epidemiology, the basic idea of it is looking at our data so that we can incorporate the evidence from the data into studying what is going on in terms of disease process within communities based on time, based on location, based on other factors with it. Now we're going to take that data, because it's not just data that we're arbitrarily grabbing. We may have some of that data within our organization, some of the places that we work, but there's also other sources that are available to us as well. And there's some vital information that is pretty common across the board that we tend to pay attention to. So on this slide, you're going to be looking at health information systems, okay? So with health information systems, there's an area that we all tend to look at, which is called vital statistics. Morbidity, mortality, birth rates are usually the key factors that we tend to see with vital statistics. So in your chapter, just as an FYI, you do want to take a look at those categories, okay? Because there is rates in terms of morbidity, mortality, for instance, between neonatal and infant. And that's delineated by the age of the child, okay? So you want to pay attention to some of that terminology. The other thing is looking at surveillance. So where is this occurring? How often are we monitoring what's going on with this, okay? Surveys are another way to gather and incorporate within your health information system. So, when you go to a health fair, one of the things they can ask you is some of that assessment data, if they, to help them get an idea. Well, they're going to take some of that information along with some of the results that you had going through that health fair and incorporate that into aggregate data that can then be used and put into the system to see and help monitor what's going on. Okay. Records. We don't just necessarily look at things that are upcoming, ongoing. We also look at things that have happened in our past. The history helps tell us what we can potentially look for and try to have an impact on in our future. So records is a great place to go. Remember, I talked about the case control as an example of records that you could utilize records to go back and review. We can analyze data from multiple sources. So I talked on our community level, we can look at the public health departments, we can look at obviously the doctor's offices, going more of an individual basis, but we can look nationally as well. So the Bureau of Census, we can look at demographic data that's associated with that. We're getting that every 10 years essentially, right? So we have an idea of what is going on and more as important, the trend of what is changing with the demographics in the US population and how that could be a potential impact on health. Okay. US Department of Commerce studies also has information, and what they're looking at are things such as city growth, poverty, they're looking at occupation, they're looking at marital status, because all those things can have an influence on what's going on within that community. And it can contribute to helping us figure out, oh, okay, so maybe we see more industrial-based occupations that have occurred. It's kind of started occurring towards that way. So what we may have seen in the past is that we have some more respiratory-related issues, or we may have certain cancers that are more associated with that. So maybe we need to start taking it and doing health education towards those ideas to help prevent that, given the condition, okay? Then we can also look at leading causes of death. So some of the things that we could look at, the big ones that you see are listed up on the screen for you: heart disease, stroke, cancer. And if you go back and forth in the literature, cancer is shown as the highest at points in time. Heart disease and stroke tend to take over at certain points in time. But I believe cancer is back up on top again. Other things are accidents and HIV/AIDS, okay? Health profiles or status and life cycle are things that you want to pay attention to as well. So remember when I just stated a little earlier that when you are looking at some of your vital statistics, the morbidity, mortality, you want to pay attention to not just the broad terminology with it, but how it's broken down. We can look along the life cycle for some of this information. So I brought up the example of what's the difference between defining infant morbidity and mortality versus neonatal morbidity and mortality. And again, I mentioned that the age of the child is going to make the difference in what category he or she might fall into, okay? But one of the things that you also want to recognize is that morbidity and mortality is also considered an indicator of health and environmental conditions. So what we may end up looking back on from our standpoint, for an epi standpoint, is if we're having a higher incidence of morbidity and mortality in a particular area, we may start looking back to see what other conditions have occurred that may come across and be a common condition for a number of those individuals to help us determine what's going on and further provide a direction for us to take care of that potential issue. So they show on the screen here as an example, low birth weight could be something that we identify as an indicator. So things that we may pay attention to, such as prenatal care of the mom, the nutrition, was there alcohol or drugs that were ingested during the pregnancy, the age of the mom, any infections associated as other conditions that are going on with it. And we could go on and on, but those are some examples associated with it. So think about whatever age group that you're dealing with right now. So this one shows it for, pregnancy and infancy, and relates to the mom and babies. But what other morbidity and mortality rates could you be involved in within your world? And what types of indicators are appropriate for that particular population? Okay. Continuing on with it, so you see, we talked about infancy before. So these are some of the things that you'll see more commonly in the childhood age group, morbidity and mortality. So they're talking about learning disabilities. They talk about drug and alcohol use or abuse. Increasingly, we have issues in terms of the weight problems with younger children, and it's getting younger and younger. We're having 6-year-olds, 7-year-olds who are coming into clinics who are already showing signs of heart disease and looking at cholesterol issues, starting to do that. So that's really scary that we're starting to see that in there. MVAs and then vaccine preventable diseases we've spoken about. Then you get to adolescents and young adults. So some of the things that you may see that contribute to the morbidity mortality for that age group: homicide and suicide, big areas that you're paying attention to. And I won't say systematically see them, but there are particular times of the year for this age group that you may see incidences of the suicide occur. MVAs, and then lifestyle choices. Teens believe they live forever. Young adults feel this, tend to have that saying. And yes, I'm generalizing when I state that. But when we talk about doing things now that are going to impact our future, we can understand it to a degree. That age group understands it to a degree. But if they're not experiencing any problems with it, they may want to try an experiment. So that's what you're looking at with this. Then we're looking at morbidity and mortality in adults. So this is coming past age 25 to 65 years old. So some of the things we're starting to see, some of those preventable health problems that starting to kick into gear, things that you have some control of. So the seat belts, and you hear a lot of the commercials related to the seat belts. Click it or ticket, is a common one in my area. So cholesterol levels, smoking, some of those other things, smoking related to cancer deaths is another one, colon cancer, and that's often associated with the diet. So what type of changes in terms of dietary do we need to make? And then other lifestyle patterns that we could explore further. Okay. Then we go into older adults, so above 65 and older. Okay. So now we're starting to look at what type of conditions are contributing to morbidity and mortality at this age group. So availability of caregivers. You find that interesting. If I don't have someone to care, if I'm dealing with some issues already and I'm struggling with the ADLs and I don't have anybody else to help me with those ADLs, how effective am I going to be? Okay. Managing those chronic conditions kind of goes a little bit hand in hand with that. And then altering lifestyles, you're going to be altering in terms of your sodium intake, smoking, the things that some of those things that we've talked about throughout the different age groups still is going to apply at this area. But the other key one that you're going to note on here is the quality of life indicators associated with it. So what does quality of life really mean for me to take care of some of this stuff? Okay. We're also going to look at it from a perspective of status of populations at high risk. Okay, so we just went through the developmental status of it. Now we're looking at those at high risk. So we're going to look at it more so from diagnoses, for instance, so health and heart disease and stroke. We may look at that and we may identify it across that developmental board. Okay, so I may look at it across an age group and I may identify it in the northeastern region of the US, for instance. Okay. You'll note that heart disease, cancer, and stroke are the top 3 causes of death. They switch around minor, in terms of 1, 2, and 3, but they typically stay up there. SES, socioeconomic status, does have influence. And so folks with lower incomes tend to have increased health risks associated with it. And minorities, one of the things you want to think about is collecting race and ethnic information, because what you see at times, depending on diagnoses, is that there is more at risk based on ethnicity as well. Okay. The other things that you may want to look at in terms of the status of populations at high risk is whatever continuing issues are going on. So what contagious illnesses are type to occur? Measles, on the cruise ship is a great example of that. What other chronic illnesses are contributing to what's going on as well? Okay. So we have talked about a number of things related to epidemiology. So remember that we are looking at epidemiology as the study of health status of human populations. So we are trying to look at it from a systematic method on how do we determine and gather the data that we need to explore and understand why health disease is occurring through this population at this point in time. Okay. We talked about the different types of epidemiological investigations. So we talked about descriptive, we talked about true experimental designs, we've talked about case control, we talked about cohort designs, which were under analytics. So you're looking at those areas, okay? Patterns of morbidity and mortality. Remember, those are some of the vital statistics that we pay attention to in our health information systems. And you will see that as a common indicator pretty much, everywhere in the U.S. I will say that, but you will often see those as vital indicators across the world as well. So from a global health standpoint, and then concepts such as natural history of disease that we spoke of. We talked about the epidemiologic triangle, multiple causation. Okay, so that web of causation, and then we've talked again and just re-emphasized the levels of prevention. So when you're looking at this chapter, remember that the numbers also matter too. So you want to pay attention to what those rates are. You want to pay attention to how to calculate incidence, how to calculate prevalence, what the terminology means, but being able to actually calculate it. So reminder that if you have the access to the video in the course room that speaks to that, review that. Okay, it's about 5 minutes long. Remember to look at your charts. Your charts give you a wealth of information. So for instance, I'm looking at visits to hospital emergency departments by diagnosis. So that is a helpful information if I'm the nurse manager on the unit to get an idea of what is really some of the leading diagnoses that we need to pay attention to. And do I need to have some type of clinical pathway that's put into place for some of these diagnoses that we may currently not have something for, okay? What kind of game plan can we put into place for it? From a community health nursing standpoint, if I'm outside of the healthcare system, that's important for us to know too, because we can start talking about primary and secondary prevention strategies that we can put into place that contribute to some of those diagnoses occurring. So from a community health standpoint, it's important for that as well, okay? Think we've kind of covered everything with that. So with that, make sure that you look at the key ideas in your chapter. Use that as a guiding point to kind of get you started. Going back and doing some of those readings based on those key points initially, continuing on with the reading from there, looking at those tables, looking at those graphs. So I hope you got some good information out of this today. And I look forward to speaking with you again. Take care.